Yeah, why not? I know everybody's time is limited, so we might as well go ahead and get going. First of all, thanks everybody for being on the Zoom. Obviously, we're doing things a little different this year. So, each year in April, Source celebrates National Volunteer Week, which this week is National Volunteer Week. Um, and during that week, we like to highlight like the work that our volunteers from Hopkins and the community have been doing throughout the year. So this year, obviously, because things are a little bit different, we sort of altered how we're doing things. So we're hosting a lot of things on Zoom this year. Yesterday, we had a host a session for our COP participants. Today, we're doing our SWEET seminar in coordination with the Annika Society. And tomorrow, we also have our Source Awards. And so those are at least three things we have lined for the week where we want to make sure that we acknowledge individuals for the great work that they're doing. And we understand that although this is a little different, we want to make sure that we still have an opportunity to highlight the great work that's happening in communities, especially with folks from the MPH class that have done some great work throughout the year. And so today we really want to acknowledge the work that we're doing. Just want to acknowledge some of the staff from Source that are on here. Mindy, Levin, everybody can see each other. So Mindy can wave, and I see Vanessa as well as Zat and Kiila are all on the chat. And of course, Nelson, who has been great helping us out with a lot of the work that we've been doing, especially with Source and through some of the student groups, HIV clinic, HIV testing and counseling, as well as the identity clinic. So just want to acknowledge him for the work that he's done as well. And with that, what we're going to do is talk to a few of our rock stars who've been working in Baltimore's communities from the School of Public Health. So we've got 5 presenters today, and we're going to give each of those presenters an opportunity for the first 5 minutes each to talk about some of the work that they've been doing in communities. And we'll start, let's see, we have Mihir, Daniel, Anna, Apurva, and Annika. I think the way that we'll do this is Mihir, we'll give you 5 minutes to talk about some of the work that you've done in the community. Then I'll ask a few more questions after every presenter has had an opportunity to speak. And if anybody has any questions that you're thinking about, especially as the presenters are talking, if you could just throw those in the chat and we'll kind of combine those and give everybody an opportunity to have their questions answered by the presenters. So Mihir, I think we'll start with you.
Great, thank you, Tony. Hi, everyone. Good to see everybody. Thanks for having me on this panel. It's great to reunite virtually. And so, yeah. So my name is Mihir. I think we're all MPH students. And just to share a little bit about the communities I've been kind of organizing alongside mutually. So I've basically been really focused on 2 different communities in Baltimore. During this year. One is in Bolton Hill neighborhood. There's the Bolton Hill Tenants Association, which I'll talk about first. And then the second part, I've been increasingly involved with some kind of community organizing work in the Middle East neighborhood. So and definitely, yeah, feel free to if there's questions in the middle or interrupt me if things come up. So Bolton Hill, I've been working with basically a group of tenants that have formed their own organization. They're called the Bolton Hill Residents Association, and they've been struggling for the past year in their in the Bolton Hill apartment unit to kind of work with the management to address some environmental health issues, particularly kind of widespread occurrence of mold and rodent infestations throughout the building. And I learned about this through kind of some folks who have been working there actually in the Homewood campus, and eventually came to be in contact with some of the amazing tenant organizers that helped form this organization. There's 3 in particular, Tiffany, Tisha, and Karen Walker, 3 amazing women who all have lived in Bolton Hill for several years, and many of whom they started noticing kind of the occurrence of mold and also rodent infestations. And then over the course of the year, several residents had repeat hospitalizations. Many kind of got progressively sicker. A few even died potentially related to this. And during that whole course of time, the management was failing to address any of their kind of individual concerns. And then so a group of kind of students, along with the residents, went ahead and incorporated into a formal tenants association, and that continued to grow. And then over the course of this year, kind of in kind of partnership with the Anna Baetjer Society, we have been partnering with the Bolton Hill tenants to help them organize petition drives, kind of social media campaigns, reaching out to various kind of local political leverage points to get the management to address some of these needs. And so before COVID had hit, we'd been making a lot of progress, and the city had actually sent an inspector and started building citations and building a case for the management to have to do something kind of immediate to address all of those concerns. Now we've shifted in Bolton Hill, and we're focusing on kind of spreading, in a socially distanced way, spreading information about the eviction rights, like kind of the moratorium on evictions that have been placed in the city of Baltimore, and addressing. The management is still trying to really get people to pay all their rent, even if that is really challenging for a lot of the tenants. So we've been doing a lot of just outside the door flyering, phone calls, trying to organize and make sure people understand that the management cannot be threatening to evict the tenants during this period. So that's kind of what our focus has been more recently in Bolton Hill. And the other piece is I've been working in East Baltimore as well with two different organizations in the Middle East. One is called Brace and one is called Reclaiming Our Community, both led by long-standing residents who live and organize their communities in East Baltimore. And they do various kinds of work. Right now, the focus with them has been on setting up a kind of sustainable food distribution network during COVID. And we had one successful, pretty large, 250 box food delivery day led by them throughout East Baltimore. And things we can get to in questions and things that have risen consistently with, both Brace and Reclaiming Our Community. Oh, thank you. Just to wrap up real quick, is there's still a lot, we talk a lot about historical trauma and historical distrust with the institution, with Johns Hopkins. And that, is definitely, I want to make sure that people know that is not historical. That is an ongoing kind of lived mistrust in reality for a lot of the members and leadership in Brace and Reclaiming Our Community. And so it's been really interesting and sometimes challenging to work with them to apply for grants and monies that exist in various centers at Johns Hopkins, though a lot of the community members are afraid of kind of a repeat of what happened with EBDI and the displacement of 700 families there. And so trying to rebuild that has been an interesting and challenging role, and hopefully we can talk a little bit more about that in the question session. Thanks.
That's awesome. Thank you so much for that. We'll try to do the questions after all the presenters have actually gotten an opportunity to speak. So with that, I will now turn it over to Daniel to talk about your work in the community.
Awesome. Thanks, Tony. And thanks everyone from Source for letting me do this. Nelson, Tony, and Anna Baetjer Society, including Mihir and everyone else. I mean, the amount of community work that I think all of us are doing is amazing. So it's just great to be able to speak about some of the experiences I've undergone here. So I've been involved in about 3 different community engagement interventions, programs, and opportunities. And I think it all started out with partnering with Dr. David Bashai. So Dr. Bashai worked off of Dr. Carl Taylor's principle of community engagement. So if anybody's ever taken a course with community-based participatory research or working with community members to uphold principles of community health, Carl Taylor is the person to go to for any international substance related to that. So we based a principle of Carl Taylor's work on how can we implement this within Baltimore. So we thought to create a coalition of different community members, government agencies, organizations, and people that want to be actively accountable for the community's health. So we decided to create the District 1 Community Health Action Network, also known as D1 CAN, because that's an absolute mouthful. So D1 CAN together, we've tried to partner with various organizations in East Baltimore and partner with organizations like the Green and Healthy Homes Initiative. Any organization that wants to uphold health in particular, we reach out to, and we try to see if they want to join as a part of the conversation. And essentially what we are trying to do is we're trying to break down these major health issues. So instead of us talking about cardiovascular health, instead of talking about cancer, so big issues that people don't see like they can tangibly assess and target, we try to break that down for them so they feel like they could take a piece of that. So that's contacting different stakeholders to bring into our network so we could discuss this further and figure out how we can branch out our network so we are braiding different initiatives together so we could focus our funding, so we could focus our capacity and manpower together so that we can ultimately tackle those issues together. And it's been successful so far. I mean, we've partnered with about 90 different organizations and individual community members, and we've been hosting meetings as well. And I have to highlight, we've been having bi-weekly town halls where we have just been inviting the District 1 community together, and we have just been talking about COVID-19. We've been talking about different volunteer opportunities, inviting people to do speeches as well about resources in the area, and it's been a lovely way to interact with the community during this time. And it's amazing how powerful Zoom can be as well. So that's D1 CAN. I'm also working with Councilmember Zeke Cohen. So I'm his legislative intern, and I am also working with him on 2 different steering committees. The first steering committee is the Healing City Baltimore initiative, and that is in tandem with the piece of legislation that we put out through his office. So we passed on February 9th the Elijah Cummings Healing City Act, which focuses primarily on gathering a task force and creating government accountability for trauma responsive care and intergenerational trauma in particular. So we are trying to look through our previous policies within Baltimore City government agencies to see how it has been how racism has been promulgated through those initiatives and how trauma has been promulgated through those different policies as well. So we created that that piece of legislation. And then we also created this component, the Healing City Baltimore component, to ultimately take what is found through the task force on that piece of legislation and bring it into the community and see how we can involve different community organizations, agencies, executive directors in the Baltimore City area, and we can figure out how we can translate intergenerational trauma and the work of the trauma task force to the community. So that's been huge. And then recently, and I didn't expect to be on this steering committee, but it's always voluntold with government agencies when you get involved, but I'm involved in the Baltimore. What was that?
One more minute.
Thank you, got that. So I'm involved in the Baltimore Neighbors Network, which is a mental health alliance where we are trying to make calls to seniors and different vulnerable populations during this time. We have a network of about 500 different volunteers, and we have about 85,000 phone numbers that we've been calling on a regular basis through these volunteer networks. We've been working with the Baltimore Community Mediation Center as well as pro bono counseling. Would love to talk more about this. I could talk about this for years because I'm in steering committee meetings throughout the entire day for Baltimore Neighbors Network. And then last but not least, have to highlight Source. I was an HIV test counselor until COVID-19 struck in the Harriet Lane Clinic. It was an incredible experience. I've tested over 40 different people for HIV and have done beautiful risk reduction counseling, and I've learned a lot through it, and it was really a lovely experience to interact with community members and youth. So thank you, and thanks for letting me present.
That is awesome. You have definitely a lot of experience, and we appreciate especially the work you were doing with HIV testing and counseling. And Councilman Cohen is just awesome to work with. The trauma-informed legislation that you were talking about, we actually tried to mirror that in Annapolis this year. So good job.
Appreciate it.
So Anna, if you would like to go next.
Sure, thanks. And thanks for putting this together. So I, through the Source Service Scholar, got involved with GEDCO, which is an organization that has a really interesting kind of multifaceted approach to combating housing insecurity throughout Baltimore City, mostly kind of north in the city. And then, so was doing sort of a project manager position where I was helping them sort of figure out ways to create venues for more effective, like bidirectional communication with their surrounding community, which doesn't access a lot of technology. So that was, I think, a great piece to need to think through. And then my other job this year was kind of street-based outreach work for folks in the kind of Brooklyn, Cherry Hill, Wilkins Circle kind of area who like sell sex, do drugs kind of stuff. So a lot of like harm reduction, a lot of like pointing people towards resources. It's hard for folks to, I mean, access is a huge issue. And that was great. And then I was also trying to help out with the stuff that here at Bolton House was doing. And those were all fantastic. And then it's been really interesting, I think, lately to see how that's evolved into this initiative that we're all kind of jumping into now, which is a response to the fact that frontline service providers who are not medical professionals and provide essential in-person services to folks in Baltimore experiencing homelessness and impoverishment really are struggling to have PPE and to be protected. They're worried about whether they can continue to provide these services, which is very scary because the number of services folks have access to was already really low and had been reduced a lot. So through my kind of partnerships with GEDCO through Source, and then my kind of like ground floor level view into what things are looking like on the ground with my outreach job, and then with this wonderful advocacy grassroots network involvement with Mihir, I've put together, we've all sort of collaborated to put together a response to this issue. So I think first of all, that just speaks to the value, I think, of showing up for people and how like the best way to kind of put your own stuff forward is to kind of like show up for folks who are already doing the work. So so we've together did a lot of scoping about making sure that the hospital systems were in fact well supplied. We confirmed that. And so now we're unrolling and sort of in the initiation phase. We're very excited. If you guys want to get involved, I'm super excited to, have all hands on deck for this. We are accepting donations. So like in-kind donations, and then we're also accepting monetary donations to purchase PPE. And so we're a partnership of community members of this nonprofit, over like 20 local nonprofits, and folks in the like public service sector, especially the mayor's office for homeless services, are going to provide this service that's basically like an equity distribution service. So folks making PPE, folks doing all these things can submit them here, and then we have eyes on everybody and can make sure that there is like a need and like an equity-based approach to making sure that the folks who are providing these services are able to continue to do it. Yeah, I mean, in the scoping, we're finding that some folks are very well supplied. They have PR teams already. Some nonprofits are like, we have so much PPE, we're like telling people to stop giving it to us. And other people are really strapped. So we're called the Baltimore Donation Hub. And you can kind of follow us on Facebook, Instagram at Be More Hub if you'd like to kind of learn more as we're kind of unrolling this. And yeah, so we have a lot of folks are into the communications piece, and so that's part of our programming and something I was thankful to already sort of have my feet wet in from my project with Source and GEDCO. I'll not take up too much more time just because I'm excited to sort of see what folks' interests and kind of questions are. But yeah, I mean, I'm thankful for Source's support and everything to sort of get the ball rolling on this year.
It's awesome. And thank you for your work as well. For our presenters, if there are any links that you also want folks to be aware of, just go ahead and drop it in the group chat, whether there's a resource site or website that you think people can go to learn more information about the work that you're doing or any of the resources that are being offered to communities. Feel free to do that as well. Next, we will have Apurva to talk about her work in the community.
Hello, everyone, and thanks, Tony, and everyone for giving me the opportunity. And sorry, my voice would be like, I've been having a cough lately. So, so basically, I have been working in the community and like recently with the COVID situation, it's not like, that active, but before I had been actively involved in two kinds of work. One was associated with the identity clinic. So as most of the folks would know, like, that Source has an excellent collaboration with the Living Classroom Foundation. And one of the important parts of that is identity clinics. So I was introduced through Tony and like other people, and I've gone through those clinics myself. And it was on Saturdays. So it worked well with my schedule, but recently they had moved to Fridays, so I was not able to involve that much. But it is a great experience. Like, you have all the returning citizens who need identity, and this is an important source that they can get, like Maryland state identification and other requirements, like the birth certificate. And you will be like surprised to know like how difficult it is for them for even getting housing or simple stuff, just because they don't have a state identification. So it is a very good opportunity where you have exposure to the real people who have been like, gone through their phases. And it was like, the first experience was really novel, because I have never been before to such an experience. But with time, it was really interesting to know more and more about the local Baltimore people, and the way Source is involved. Like, I was just involved in the identity clinic, but they have like development courses. They have people who can get them back to the job. So there's an ample opportunity, and they have like kitchens and like other stuffs where you can get involved. And I found that a very resourceful way to give back to the community. The other program, as I was a faculty in the summer jobs, like, the summer medical school intensive. So I came across a Adopt a Class program. So this is run by the JHU summer programs group. And in this, what they do is that they target the 4th and 6th grade students. So it's really one of the, I should say, the most difficult as well as the most exciting, because a team of like 4 to 6 volunteers, you are assigned a class. So I was assigned to Wolf Street Academy, which is just around the corner of Hopkins. And the way students would behave on the first time when you reach there, like, they are excited, but they don't know what you're going to do. But it is kind of like, that every month you meet them, you talk about their teamwork, SMART goals, how you plan, you give an idea like what are the different ways they can be involved in medicine and like, future careers. And then this is like a monthly thing, goes for 6 months. And unfortunately, this time, I don't think they will be able to do that. But it culminates as a career day program where those students are brought to the schools. And 2 of our volunteers were there from before, like they had previous experiences, and we saw the excitement the students saw when, like, the similar faces, like how they excited after a year. So that was another kind of like, and they were all excited. They had a journal. We had given a journal. They had to write reflections and kind of like, talking about how you can plan your career and think about things about future. So that was kind of like, the 2 things where I was involved. So.
Awesome. Thank you so very much. I was about to give you the 1 minute sign, but you wrapped it up. And our last presenter, but not least, who I'll give an opportunity to speak, is Annika.
Hi, everyone. So just like Anna, I'm a Source Service Scholar. So through that program, I got involved with the Family Tree, which is an organization here in Baltimore. And they're primarily focused on addressing child abuse and providing resources for families in the Baltimore community. They provide a wide variety of services. So that includes parenting classes. They do counseling sessions for parents in the community. And then they also do home visitation for parents, where they just teach them different skills for issues they may be having. And then another service that they provide is they have a 24-hour parenting helpline that is run by volunteers. And this is more of like a hotline for parents who are having not necessarily a crisis situation, but something that they feel like needs to be addressed immediately. So they can call the hotline and receive resources, or have sort of like a counseling session where a volunteer will talk them through the situation that they're going through. So my main focus with that organization has been working on the training that they currently have for the volunteers who run the parenting helpline. So the training that they have now hasn't been updated in, like, I want to say over 10 years. So it's very, very old and outdated. And what the family tree asked me to do is to kind of observe how the parenting helpline is being run now, and speak to the current volunteers, sit in on different calls so I can get a feel for what they do, and then conduct research on organizations who do similar work. So I interviewed probably about 20 different organizations across the nation who run parenting helplines like the family tree. And right now we're in the process of using all of that information from the interviews to develop a new training for them. And it's been really great. It's led to us like focusing a lot more on like trauma-informed conversations when they're talking to parents on the phone, trying to like prepare volunteers for situations that are maybe more relevant now than they would have been 10 years ago when the training was first developed. So that's my project right now with the family tree. And then the other project that I'm involved in is I work with the Opioid Operational Command Center in the governor's office. And they are like they're actually part of, technically they're under the military, but they're part of like Maryland's Emergency Management Agency. And the organization was created in 2017 when Governor Hogan declared a state of emergency because of the opioid epidemic. And they do, they're basically in charge of the state's opioid response. But my main project that I've been working on this year is I'm running a systems gap analysis for them, which is looking at all of the different treatment facilities in each county in Maryland, and then looking at the different needs of each county, which takes into account their mortality rate for opioid-related overdose and opioid-related death, and then their population, their hospital admissions, and a few other factors, and is just trying to assess if each county is meeting the needs of their citizens in terms of treatment. So those are the two things that I've been working on so far this year.
Awesome. Thank you so very much for your work, and for all of our presenters for all the work that you've done this year. I will start off with a few questions. My first question, being a Baltimorean, I'm always interested in knowing other people's perceptions or ideas of the city of Baltimore, and especially the communities that you work in. So this is a little different for us. We're going to try and unmute the presenters, and anybody can jump in to answer the question. But how has your experience in the community enhanced or changed your perception of the community? I don't know if anybody just wants to jump in.
I could jump in.
Yep.
Great. So I always start this out by saying I'm an avid New York Times reader. I like read a lot of New York Times. I like subscribe completely. And if there's one thing that the New York Times and the media does, is it portrays Baltimore as this city of deficits in a way. It portrays Baltimore as having some of the highest rates of violence that we see in the country. It portrays Baltimore as having youth that just are not engaged with school, that youth that are just completely disconnected from the system in general. So the moment that I stepped into Baltimore, the first thing that I felt was fear. I mean, that's what everyone typically feels. It's a really scary feeling to have something portrayed in that manner and then jumping into a community like that. But after working with the different community associations, after talking with community members, after after describing what they have experienced and hearing about their life experience as well, I became less fearful about the area, and it really changed everything about Baltimore to me. I love the community that I'm in. I love the people that I'm working with. I love working for the councilman because I'm able to talk with different people that I probably wouldn't have had the opportunity to engage with prior to being at Hopkins. But it's been such a great experience to be able to walk into the community and feel like I'm a part of something that's bigger than myself. And I love it, because now I feel I'm attached to Baltimore. Now I feel like I understand what the lived experience looks like, and it set it straight. It just shows that the media really can stray an option and stray an opinion about what you are about to experience. So,
Absolutely. Thank you for sharing that. And anybody else want to jump in?
Yeah, I can. Apurva, you can go ahead. Okay, yeah, mine's a quick comment. Sorry, going off of Daniel, I think the climate of fear, I think there's a lot of actually barriers which keep students from like genuine engagement with communities that are already autonomously organizing and are resisting a lot of kind of marginalization and, you know, seeking ways to have their own political power. And I think there's a few things. One is the climate of fear is big, and the second is actually like that combined with infrastructurally. You can be a student at Johns Hopkins and literally between the Lyft ride service and the shuttle, like never really leave Hopkins, like never actually enter into Baltimore. And so you even like, you know, going to Northeast Market or just like leaving literally the blue lines that mark Hopkins territory is like a built-in challenge for people. But once you do that, you realize that there is like already an incredibly like autonomous, powerful community that has been organizing for some time.
Yeah, I would share similar thoughts, like coming from New Jersey and like, you know, before that India. So when I was coming to Baltimore, there was a sense of fear and kind of a feeling that what it would be, because Hopkins is actually located and, you know, in the heart where people are really scared. But I think my exposure to the identity clinic and actually meeting those people who are kind of like, you know, they're doomed, like they have problems and other issues, you feel how it's different. And I think the biggest challenge for each one of us who comes here is to fight that. Like, you know, that feeling that no, somebody is not bad. It's the situations that worsen the, you know, the surroundings that make it worsen for any person. So I think that was the biggest, you know, I should say awakening. Like now I don't feel the same scare when I talk about Baltimore, and like, you know, I'll be leaving soon. So I think that now I don't have the same kind of feeling of returning to Baltimore. So I think that that's where it is.
Great, thank you. Let me see. I will, if anybody has any questions that you want to ask for any of the panelists, please add that to the chat. But for any of the panelists, how's your experience getting involved in Baltimore's communities prepared you for becoming a public health professional? Anybody want to step up and answer that one?
Yeah, I feel like that's part of what I was trying to express briefly, is just the by prioritizing sort of what folks say their needs are, and by just, you know, kind of just showing up, you sort of find your place and you like learn how to like effectively move through an environment and a setting, and you have allies and you kind of understand things. So it's just, I mean, at least from my perspective, it's been like completely crucial.
Thanks. Anybody else?
I would like to add, like, you know, that I took the MPH course part-time, half of that course is like, you know, inside. And through the training, you get all the exposure of different subjects. But this kind of like, you know, these exposures that you have, like leadership classes and other things which make you communicate with different organizations, that makes you as a better person to tackle like how you get to the leadership, how you work as a team. And like, you know, unfortunately this is the situation that we are in COVID pandemic, but how our institution has brought the whole pandemic and how they have been working day and night. And I think that's the biggest inspiration I would feel, like, you know, being a part of Hopkins, that today we feel that, you know, we are trying to remove every misinformation out there. We are trying to work in every way so that we can provide, like, you know, we are volunteering to make PPEs and other stuff. So I think there is a lot to learn given this situation as a crisis, but also as an opportunity where they have come out with, like, you know, endless opportunities, I would say, to become a more aware public health professional.
Awesome. Thank you for that. We do have a question that, oh, I'm sorry, Daniel, did you want to add to that?
I was actually going to bridge that and Alex's question because it makes a lot of sense. I think one thing that here at the School of Public Health, we hear a lot of is that when you are performing research, when you are doing work, implementing a program, or figuring out a way to improve health in society, community engagement is just thrown out there as just this word. And I think it gets very much lost. I think community engagement has become this buzzword where it's just like, oh, well, engage the community. All you have to do is engage the community. But like the work that all of us are doing, where we're actively working with different community partners, is hard work. It takes a lot of skill and it takes a lot of time and effort. And people don't recognize that in order to bridge distrustful systems, in order to bridge that gap between community members that might not trust the research that you are doing, or might not trust the programming that you're doing because of the place that you're coming from in terms of being from Hopkins, then I think a big thing that we have to do is we have to recognize that we're not the experts in this. I mean, just because we are public health professionals, we don't know the lived experience. We don't know what other people know within the community. And I think it's our obligation that when we are public health professionals, in order to bridge that divide, we need to be listening actively to what the community has to say and what they see as their issues first and foremost.
Yeah, I think, just to echo what Daniel's saying and bridge, I know Elise has, you know, the question on the distrust between Hopkins and surrounding community. So I think actually, you know, like at least my experience working with folks in East Baltimore is like, you don't want to be a public health professional. Like East Baltimore is like very justifiably suspicious of professionals, whether it's, you know, Henrietta Lacks and that whole thing, or the Kennedy Krieger experiments on, you know, predominantly Black communities. Like professionals do not necessarily have like a trustful connotation for a lot of communities in East Baltimore. So it's kind of like, I think going back to Daniel, it's like being a person who has like certain social capital and access to resources, and listening and taking your lead from the communities and the folks who you're working with, who are leaders in those communities, to be that bridge. And the more layers of separation there are, or the more that, you know, like either whether it's professional status or your institution, like those things need to be worked through, though it's really more of like the human connection that is supposed to bridge past and kind of abstract through a lot of that history and a lot of those things that you need to breed some distrust.
Thank you for that. I do have a question that came in from the chat. Based on your experience, what is the most challenging and the most effective way in rebuilding the existing distrust between Hopkins and the surrounding Baltimore communities? So I guess what's been the biggest challenge, and what has been the most effective way that you've been able to build around the existing distrust between Hopkins and the communities that you were serving?
I can't really speak to the biggest challenge necessarily, but I think that one way you can try and address the distrust between the community and Hopkins is by being really mindful and coming in with an attitude of, you don't know everything. You don't want to come across as like the expert on something that quite honestly, you probably aren't the expert on. You're here as someone who is making yourself available to assist them. And so you really just need to make sure that that's clear, that you're someone who's here to help, not someone who's here to direct and take charge and tell that organization what to do. I think that's super important.
Anybody else want to add to that? All right. Another question. How do you bridge the information you learn in class and actually put that to action in the community?
I just spoke, but I with my project with the family tree, I am a JD MPH student, and last year, my first year of law school, I did a kind of a similar project where, not with an organization that works to prevent child abuse, but with different legal organizations that provide pro bono services to clients, and it was similar in interviewing different organizations and trying to like determine what best practices are to assist that organization in adapting their practices. So it was like I could take a lot of what I learned through that process last year and then apply it this year. And I think it made my interviewing process much, like, it went a lot more smoothly than it did last year when I was trying to do things, because I just had learned those communication skills in the past. So that's one thing. And then also with the Opioid Operational Command Center, I mean, I've taken this year quite a few classes on, like, I took an opioid seminar and US drug policy. And I think a lot of those concepts, like especially things with harm reduction, are now, like, the OOCC is trying to implement more of those things. And so it was great to, like, see them actually trying to take those things that we learn about and implement them in the state.
Anybody else? If not, I do have another question that came in the chat. And this is from Dr. Marie Dina West. Thank you for being on. For everyone, but Mihir especially, how do you sustain your efforts for next year?
That's a great question. Thanks, Marie. I think that's always really important to think about. So I appreciate that question. And so for, Bolton House Residents Association, that's something we have discussed, and I think honestly we could have talked about more. The one thing that we knew going into working with that community is that there were other organizations and other kind of organizing groups, such as Link Up and the Baltimore Right to Housing Initiative, that were already actually involved in that space. And so we were kind of boosting their efforts. And I think it's something that has to be really thought about, especially if you're going to be the, one of the main partners with an organization, is how to make it sustainable for us. So I happen to be here next year too. So we'll continue to, like, be a bridge, and you may be able to continue some level of Hopkins involvement in both BHRA and East Baltimore. Though also, in the East Baltimore groups, those initiatives already exist and are actually connected to various parts of Hopkins, more so on the Homewood campus. So I think it's not something that honestly is completely solved yet, though and especially with the MPA structure, with the one-year structure, there's very little institutional memory, or often it's challenging to pass that on to the next year. So we're still coming up with ways to make that handoff and make it like an opportunity that future students can plug into.
Awesome.
I just want to echo handoff, I think in particular. I think that's so important. And I mean, anytime that you sign on to working with a coalition, or if you are even starting a coalition or helping to establish something within the Baltimore community or anywhere, it's important that you figure out how you can phase yourself out and phase other people in if you see that you are nearing the end of living in that area and being within that experience. So like really making sure that you have guides is very important. I mean, I've done the handoff thing before. I used to work as an executive director of a YMCA locally back in New York. And when I was transitioning out of that phase, I made sure that the next person had guides, had all of the different implementations that I put in measures, all the reporting measures. Everything needs to be written down. Make sure that you're documenting, make sure that you're able to pass off that information, and make sure that the next person that's coming up has the capacity to do so. And if not, find a way to get somebody to do so. Set people up for success and don't leave things to be completely decimated. The work that you put into whatever you're working on in terms of a coalition or an organization, it's important to keep that effort up and that energy high.
Yeah, I want to echo on what Daniel just said, because I think what we are talking about, the distrust and between the community and the Hopkins, I think perseverance and sustainability is what makes that all possible and feasible in the long run. And I was fortunate that I was involved in a program which had been running for a long time. So, by the time you were assigned to identity clinic, by the first time you know what you have to do, by the second and third time you are almost trained. Similarly, in adopt a class program, we had a whole setup for 6 months, like what you are doing, and every time you have a a Google folder or something where you can look up, okay, what we can do, what the last time did. So I think that is a very important part. And if you are doing something for the first time, if somebody else wants to do it after you are leaving, a very important and essential part would be to keep everything in documented state so that it can be taken where it was left off rather than starting from scratch again. So
thank you for that. All right, I think we got time for one more question before we wrap up, and this is for any of our presenters. Give us a valuable suggestion you would have to your peers in preparing for their careers in public health, especially as it relates to your experience this year working with the organizations you've been involved in.
Can we add a bit more on there too? First off, thank you for everyone that presented and for all your community engagement. It's truly critical in for the most part, everything we do in our professions. So my question is related to sort of how you're going to take these skills and experiences from community engagement this year in your careers moving forward.
To answer Nelson's question about how I'll take what I learned this year into my future career, I mean, I think also through the Source Service Scholar program, paired with working with the family tree, I've learned a lot about communication and setting realistic expectations with organizations, being very transparent with what you're going to be able to do when you're considering everything else that you have on your plate. That's especially true when you're a student and also doing work in the community, but I mean, that's going to remain true throughout our careers as well. There are always a lot of things going on. So I think just being able to become more comfortable with being very transparent and honest and open and knowing that that's not an issue, it's actually better to take that route.
Anybody else want to try that one?
I mean, I could talk a little bit about every time I work with Councilman Cohen has a schedule that is abhorrent. And Tony, I bet you could attest to this as someone that works as a delegate, but it's back to back constantly. But the thing that Councilman Cohen does is he just listens. We always tell him that the major part of his job is just to listen to people. It's to schedule out time and it's to sit down and actually hear people's thoughts. If people want to rant and rave, they can rant and rave. If people want to find solutions, they can find solutions. But I think the big thing at the end of the day is to take the time in your schedule and to allocate it to listening and to just hearing what people have to say. Don't jump in with thoughts, just let them speak and take notes. I think that's vital for working with communities, and I'm going to take that forward for sure. But I also want to address what Cloney wrote in the chat, which was how do we balance individual priorities with with the ones that we do working in the community. I hope I got that right, Tony. But I kind of combine the two, honestly. I mean, like the work that I did within the community and the work that I did with the HIV test counselors and with working with Councilman Cohen, I mean, that's all experience that I wanted to get out of this program. So I made sure that within my personal curriculum, like I set aside time designated for doing this work, learning about policy in the field, learning about working with communities in the field, and like really engaging people in a meaningful aspect and utilizing some of the principles from some of my classes in terms of like a stakeholder analysis or figuring out how you can partner effectively with people and building these collaborations. I mean, these are essential like cornerstones to my curriculum, and I made sure that that was essential when I'm translating that to the community.
Awesome. So look, I want to respect everyone's time. On behalf of Johns Hopkins Source and our community partners, we definitely appreciate all the work that you've done in Baltimore's communities this year, and especially for everyone on here. I know that you all are doing work in Baltimore, and we appreciate everything that you've done. One of the things that we want to do, though, is ask that you help us to continue to tell the story of Johns Hopkins' commitment to Baltimore's communities. And the best way to do that is by making sure that you actually report your service hours. If anybody have talked to me, you know that I'm always talking about reporting those service hours. So we ask that you please make sure that you go back and go to, I see Mindy has posted it in the chat, go to source.jhu.edu/report to report your service hours. Look, those hours are really important for us. For us, it's really about making sure that we tell the story, but it's also important that we have metrics related to our community engagement work. And the resources that we have, the things that you do, really tell the story of the resources that the community has at their disposal when working with our students, faculty, and staff here at Johns Hopkins University. So please make sure that you report your hours. And the other thing that I can't get off this Zoom without telling you about is the fact that while you are home or in your apartments or wherever you are, you still have the opportunity to go online and fill out your census form. So if you have not filled out your census just yet, please make sure that you go online and fill out your census form. It's really easy to do this year. You can do it online for the first time. You can also do it by phone. So there's an opportunity while you're home to go online and actually complete your census form. And so actually Mindy has posted that as well. And so again, thank you all for coming online today and partnering with us in Baltimore's communities. And thanks for all the work that you've done, especially for National Volunteer Week. And for those of you who I will not see for the rest of the year, hopefully I'll see you tomorrow for the Source Service Awards. There should have been an email that you may have gotten inviting you to the Source Service Awards for tomorrow. But even without that, we just want to again say thank you for all the work that you've done throughout the course of the academic year. So with that, I will give you your time back and thank you all again so very much.
Thank you. Thank you.
Thanks,
Thanks,
Tony.
everybody.
Thank you.
job, everyone.
Oh, wonderful.
Yeah, thanks, everyone.
Thank you.
This was great and certainly wonderful to hear everybody's thoughts. Couldn't have said it better ourselves, so we appreciate you and celebrate you. Thanks.
Thank you.